My name is Carissa Davis. I'm from Iowa Western, and my presentation is over cystic fibrosis. Cystic fibrosis is mucus produced by the exocrine gland that is abnormally thick, causing an obstruction of the small passageways. Cystic fibrosis also has a family history that's passed on from parents to their children, as long as both parents carry the same gene that is the long arm of chromosome 7. It is also seen more in the Caucasian ethnicity. Cystic fibrosis affects some of the body system. The respiratory system is affected by abnormally thick, sticky mucus that obstructs the airways. Some of the issues that is seen with the respiratory system is chronic infection, inflammation that can lead to bronchospasms, and hyperventilation. As the lung turns fibrosis, it can lead to pulmonary complications and even heart failure. Respiratory failure is usually the cause of death with cystic fibrosis. The digestive system is also affected. Pancreatic ducts get blocked by the mucus and prohibit the digestive enzymes to secrete properly. The body needs these enzymes to be able to digest and absorb protein, fat, and carbohydrates. It can also cause bowel obstruction from the thick mucus and cause gallbladder abnormalities. As a child gets older, there have even been some cases where they develop type 1 diabetes. The integumentary system allows the body to secrete sweat. With cystic fibrosis, it leads to both sodium and chloride, that is, 2/3 of the normal rate that is being secreted in the sweat glands, that can cause dehydration, electrolyte imbalance, hyponatremia, and even hyperchloremia. Many children complain of having dry mouth, and the infection susceptibility is also increased. The reproductive system can be affected in people with cystic fibrosis. 95% of the males have been reported to being sterile due to the obstruction of the different ducts and the seminal vesicles. Fertility in females is caused by abnormally thick cervical mucus, which it doesn't allow the sperm to cross over the cervical canal. Some of the symptoms with cystic fibrosis that's seen in children is a persistent cough that can be either productive or non-productive with sputum, frequent lung infections such as pneumonia, bronchitis, and wheezing, being short of breath. Some of the other signs and symptoms you'll see is cyanosis, barrel-shaped chest, clubbing of the fingers and toes, a distended abdomen. Some of the children complain of a salty taste, poor growth, poor weight gain, infertility in males, and also a greasy, bulky stool. To diagnose a child with cystic fibrosis, they go off genetic testing, a blood test, the ITR test, salt in the sweat, chest x-ray, sputum test, a CT scan, and a pulmonary function. Treatment for cystic fibrosis: they manage weight along with their nutrition. They want to make sure they have a positive expiratory pressure, active cycle breathing technique, an exercise program, a chest postotherapy, and also a postural drainage, respiratory medications, antibiotics, vitamin supplements, and in some cases they may have to have a lung and or pancreatic transplant. Education is important. You just don't want to educate the patient. You also need to educate the parent. We want to make sure that they know how to use all of the equipment properly. We also want to stress the importance of the need to keep regular provider visits for the child. We also want to make sure that they keep up to date on the immunizations. Also, a diet. We want to make sure that they increase their calorie intake on a daily basis. Also, we want to teach them the signs and symptoms to watch out for any kind of type of infection, especially a respiratory infection like pneumonia, bronchitis. And then also we want to make sure that they are referred to support groups, because patients and family need to make sure they have a good support system. A nursing diagnosis with interventions for cystic fibrosis is ineffective airway clearance related to thick mucus production. We want to make sure we educate parents and caregivers on the proper chest physiotherapy and postural drainage procedure to loosen up the mucus buildup. We also want to make sure we educate the parents and caregiver on the importance to provide emotional support to the patient. And we also want to encourage activity to the patient as they can tolerate it. NCLEX question. A clinic nurse is providing instructions to a mother of a child with cystic fibrosis regarding the immunization schedule for the child. Which of the following statements would the nurse make to the mother? The answer is 4. The child will receive the recommended basic series of immunization along with the yearly influenza vaccination. A school-age child with cystic fibrosis asks the nurse what sports she can be involved in as she becomes older. Which of the following activities would be most appropriate for the nurse to suggest? The answer is 1. And there are my references. Thank you.